Hi, welcome to the Move Muse podcast. I'm your host, Kristen, physical therapist and founder of Moveology Physical Therapy and Wellness. I invite you to pull up a chair, sip on your favorite drink, and join me in real conversations around movement, health, business, and loving life. Hi, welcome to the Move Muse podcast. I am so excited because today we have a guest, Dr. Ladikos, who is a lifestyle medicine pharmacist, and I am excited for you all to get to learn a little bit more about what that is and about Dr. Ladikos and his services. Today's going to be a good conversation. Everyone is taking some type of prescription or over-the-counter medication, supplements, or nutrition powders. But do you know if you're taking them right or what the side effects are? I cannot wait to get into this one. So let's get started. Hi, welcome, Dr. Ladikos. I'm so happy to have you on today.
Great to be here, Kristen. Thank you for having me. I appreciate it.
So tell me a little bit, and me, the listeners, about yourself and your career path.
Sure. So I am a doctor of pharmacy. I am a lifestyle medicine pharmacist, which means that I get to help people and help physicians with their patients in all things medication related, supplements related, herbals, powders, Eastern medicines, put all that together with nutrition, with general lifestyles, sleep and stress management. And you have a lifestyle medicine pharmacist like me.
That is a lot. And it's something that we are dealing with like every day.
Yes, most people are, and as you had mentioned, most people are on some medication. There are people who should be on medications and they're not. There are people who were on medications, stopped them because they didn't realize how to manage some of the side effects of those medications, or maybe the medication were taking too long to work. Expectation management or mismanagement in that case. And I enter into that picture and I try and educate patients. I try to work with them with their all their medication continuum, if you will, on the over-the-counters, the supplements, the herbals, and of course the prescription medications, and all that, and managing and seeing how that works with their liver and kidney function and how to adjust those medications based on those two organs, looking at also the diagnoses and see what's important for them, what they should and should not be on. So I look at the whole continuum of medication therapy management for patients.
I think that's something that is so important, and a lot of people don't even realize that pharmacists can help them beyond like just dispensing and prescription medication. So
it's
really
important,
like it.
And it's a great thing that you bring that up. Yes.
So your clinic model is kind of unique because you focus more on the cognitive services rather than dispensing medications. Is there a patient or a moment in your career that kind of where you realized that people were needing more kind of education and guidance?
It's a great question. So I entered into the pharmacy universe actually as a second career. My first career was actually in the business and finance universe, having started at a few companies and working in the banking industry. And then about 15 years ago, I decided to make a change into the pharmacy universe. I was always fascinated with nutrition, with science, with pharmacology. And so pharmacy school seemed as a natural out to that. After pharmacy school, working for Johns Hopkins, NIH, I was doing research as well. I found that I was helping obviously patients in those hospitals and in research settings, and also helping family members and friends trying to optimize their medications and their nutrition and their mental health. It had occurred to me, actually, one of my friends, after I saved his life in stopping him from taking the wrong medication, he turned and said to me, "Wow, you should make a business out of this. You know, you saved my life, and I'm indebted to you." And so that got me thinking, well, wait a second, if I could do this and not just help out family and friends, but actually broaden the scope, here we are today. And so, to your point, I had to choose between opening up a regular standalone pharmacy to compete with all the other chain pharmacies and some independent pharmacies, all of which are very important in what healthcare in the healthcare model. Rather that, I decided to do more cognitive services where I don't have I don't sell any products. I don't manufacture or make any products. What I sell is cognitive services. So I help people, I help medical teams optimize patient care, hence the term, hence the phrase MedOp advisors. And so in doing so, there are so many pharmacies out there. Rather than competing, I decided to do something different. And what I hope is far more helpful. What I try and do overall is I don't try and take medications away necessarily. I'm not against medication use. I am for the judicious use of medications and therapies and over the counters and supplements. If a patient has a situation that they need a medication or supplement, fantastic. Let's optimize that care.
Right.
More often than not, patient actually does not need those types of medications or supplements or herbals, in which case they'll be just fine without them. Maybe just changing their diet a little bit and changing a few nutritional components from that. You'd be amazed as what a small change in nutrition can do for the body.
Yeah, I think there's just a lot of people trying to do the right things for their health, but there's so much information. And then you're going to so many different providers, and even within just your primary care physician versus your cardiologist and your endocrinologist. And they have an awareness of the medications, but then like not how maybe how one person is kind of their guideline for treating versus another, and how those are kind of all interacting together. So how do you go about like communicating between the different providers?
It's a great question. So, what most people don't know is that the number one reason for emergency room visits is medication related.
Yeah.
Either the medication worked too well and something bad happened with that patient, or the patient didn't take the medications, ended up in the hospital, or there's a nasty side effect that the medication caused that the patient was not aware of, or was overwhelming the patient. And either in any of those cases, medication related emergencies are the number one reason for emergency room visits. So I enter into the phase of either helping people while they're in the hospital and help transfer them out of the hospital, or ideally prophylaxis, try to work with them before they get to the point where they need hospitalization, and
Okay.
optimize medication, nutritions, and supplements and so forth there. So probably the second worst thing that I've seen my patients that happen to my patients is this miscommunication between the continuity of care between physicians, between all the physicians taking care of a patient. As the older one gets, usually there are more and more specialists involved, and more pharmacists involved, and so forth. And most of those people don't talk with each other, unfortunately. So it's the burden is on the patient to educate each one of those providers, each one of those medical offices, on exactly what they're taking. And most people don't realize what they're taking, or worse, they're actually taking them incorrectly, thinking that they're taking them the right way. So what I do is I do what's called a medication therapy review at baseline to determine what the person is taking and what they're actually taking, as opposed to what they're just simply prescribed. Many people, again, sometimes in error and sometimes intentionally, are taking medications the wrong way, thinking that they're trying to change the course of their disease with minimal input from the person who prescribed them those medications, which is probably not the best thing to do in most cases.
Right.
But I go in there and I actually try and coordinate care with all of those physicians and all those prescribers, and then educate the prescribers on what the patient is actually taking and how they're actually taking the medications. The best medication in the world doesn't work if the patient is taking it incorrectly.
Right. Yep.
And
Definitely.
and just to complicate matters further, if a prescriber, physician, nurse practitioner, PA, are prescribing medication, they're hoping and they're thinking that the patient will take it the right way. And if they're not, the prescriber might add a higher dose, and or even add a second and third medication to treat a disease, when in reality all the patient is doing is taking it the wrong way, taking it the
Yeah.
wrong time of day, taking it with the wrong food, taking it with with another drug that's countering the effect of the first drug. So all these different areas, even genetics plays a key role in this as well. So if a person who is has a certain genetic profile is taking a certain medication for a specific disease, there are actually um, genetic specific differences between people, such that they warrant different types of medication, different classes of medication for to help them with their disease states. So I go in there and I optimize each of those components, and then both educate the patient caretaker and their family, and the prescribers of those medications to make sure that everyone's communicate in appropriate communication.
Yeah, I see it definitely kind of within my practice more often patients probably not taking medications at the right time of day. And that's something that I can't really guide on, but I have, a little bit of a background and knowledge. And I'm kind of like, maybe you should be talking to your physician about when, during the day that you should be taking, these various medications because they're either making them super sleepy or they're not kind of coordinating with other activities or food, levels kind of throughout the day. So I've kind of seen that quite a bit. So what's something that people could do to kind of figure out kind of how to go about knowing if they have an issue, if they need someone to talk to about this?
Again, really good questions. Again, most people are taking medications, which is a fantastical thing if you look at it. Where 50 years ago, very few people were taking medications, and now most people are taking medications for something, if not prescription medications, then over the counters and herbals and supplements and shakes, and each one of those things, again, when used appropriately, might provide some value. Oftentimes, especially as you get into the nutraceuticals and the protein shakes and so forth, there's a lot of issues with those. We can probably do an entire podcast just on that subject alone, let
For
alone
sure.
herbals and Eastern medicine. Not to say that they are without good cause, but I think they've been held up a bit higher standards than what I think most people expect of them. If they really knew what's inside them, they probably wouldn't touch them. So again, that's probably fodder for another podcast.
Yeah.
But I think what's important to understand is that people need to understand what they're taking, why they're taking it, and then not just simply going to their doctors and saying, I have this problem. The doctor only has a few minutes to spend with them. Again, because the healthcare system, I guess, as we're in the United States, is a little bit suboptimal. And so because of that, inability to provide great perfect care to all patients, it is sort of limited, unfortunately. And so it's a perfect area for me to come in and then help and bridge those gaps between prescribers and patients. But I think when patients are able to ask the right questions, such as, okay, I have this issue, other than medications and supplements, what can I do to optimize my condition? Do I need to have a prescription medication for this? Can I eat a certain food? Can I participate in a certain exercise? Can I see, for example, a physical therapist to help me with some of these
Mm,
things there?
yeah.
I think you and I have offline have talked about mind, body, and spirits. The trifecta of great health, and you and I approach mostly the body, but some mind and some spirit in our respective approaches. And the body, necessarily is what we do, although albeit from different angles. And I think if people would be able to understand that trifecta of the mind, body, and spirit, such that these medications and therapies are good, but they have side effects that can be detrimental. If they ask the right questions, such as, do I need this medication? How do I take this medication? What can I do to get off of this medication? I think is a very good start in promoting optimal health.
Yeah, I can go so many ways just off of just that answer, but I do really like that there is kind of this movement that I'm seeing to have more of a proactive healthcare versus the reactive. I think it's a hard hill to climb, but I think there's a lot of individual practitioners that are seeing the need for it, as well as patients demanding that something be different instead of just reacting and putting on this medication and then that medication. So I completely love that kind of approach. And I think that there's a lot of people that are out there kind of looking for that. Talking about the side effects though. So are there some side effects that you think people are normalizing without realizing that it's actually medication that could be contributing? That may be a hard question, depending on.
Effectively, every therapy that a person could take has some type of side effect. Sometimes we clinicians will use that side effect to our advantage. For example, there are a number of antipsychotic medications or antidepressants, which are extremely important in the right population. And some of those antipsychotics and some of those antidepressants have as a side effect sleepiness, causes drowsiness. So what we would do is, if you have a patient who is depressed, who's in need of antipsychotics, and or is in need of antipsychotics, that also has an issue sleeping, well, naturally we might prescribe one drug to sort of kill two birds with one stone, if you will. Great. We say make sure you take this medication at night, such that you wake up less depressed, and you wake up hopefully with a better evening of sleep, because then that drug will help you with both. Sleep hygiene is one of my pillars that I work with my patients to optimize. It is literally vital that a person gets good sleep. And so one of my pillars of therapy is indeed sleep hygiene. So for side effect management, that's one example. Unfortunately, most side effects aren't in our favor and need to be managed appropriately. Unfortunately, you get into the universe of what's called polypharmacy or polypharmacy prescribing, where a person comes in, is diagnosed with one disease, and then is given one medication. That medication has a number of side effects that were either not clearly explained, or perhaps that patient might be a little more sensitive to those side effects. The patient comes back to the doctor, complains about the medication. The doctor, rather than managing the expectations of that medication and then identifying potential differences in other medications or even non-medication therapies, they then will prescribe a second medication to manage the side effects. Right. And so on and so on and so on. That's called polypharmacy. And I've seen patients, particularly in the geriatric population, that they're on 50 different medications, most of which they don't need. They probably needed about a dozen at most, but the other 30 and 40 were to manage the side effects that each of the other medications were prescribed. And it happens every single day. And it's something very real.
Just kind of talking, I know like I have a lot of friends that have, aging parents and maybe kind of noticing and seeing some of that. Is there a place that just a general person can start with trying to figure out if changes need to be made, or anything that, I don't know, like to recognize? When you pick up prescription medications, does the pharmacist behind the counter know?
So every pharmacy has a pharmacist who has a doctor of pharmacy, as I do as well. And their job is to also help manage patients' medications and side effects and educate them. Unfortunately, and I feel bad about this, is that the pharmacists in many of the retail community settings are overwhelmed. They're understaffed, they're busy, and they don't get paid necessarily for dispensing advice and education. They get paid to shoot injections and vaccines and to dispense medications. And that's that's very unfortunate. These are fantastic people working in pharmacies that are not working to the top of their degree, educating people. Unfortunately, they're too busy dispensing the medications, checking medications, which is in of itself a very important job. And so, if you can bend the ear of a pharmacist in a patient's pharmacy, that will go a very long way. They are a great source of information. They are experts in medication management and side effect management, and looking at drug interactions or drug disease interactions that medical offices sometimes are too busy to explore at the granular level. So definitely pharmacy. And if you are unable to get a hold of the pharmacist with enough time, then definitely talking with a prescriber about that. And really, most importantly, when a prescriber does prescribe a medication, ask those important questions. Tell me about this drug. What should I expect? What are the expectations? When will this drug start working? What is what's called the onset of action? What are the side effects? When should I expect the side effects? What should I do if I see, side effect A, B, or C? What should I do if I don't see effect D, E, and F, etc.? Right. So having the conversation with the prescriber, not just simply, oh, I've sent this medication to your pharmacy. See you in 6 months or 12 months from now.
Right. Yeah. That is very key to kind of understand. And so what would the process of working with you look like if someone was looking to reach out to you about your services?
So I put everything on my website, medapadvisors.com. And in that website, I've added a component where people can schedule a 15-minute free consultation to see whether we would be able to work together. And then from there, I have a plan where people can schedule a full consultation, a full 1 hour consultation. Usually probably will take a little bit longer than that to get together and talk. I'm the Dallas Fort Worth Metroplex, so anywhere in North Texas, I can meet them in person. Otherwise, I would be able to connect with them virtually online.
Great. Yeah. Awesome. And so then they would kind of, I guess, obviously, like in that first like discovery call, you're going to get information about what they're looking for and what their needs are. And then it's just kind of going through all of the medications that they're on and the times of day, just kind of getting a journal basically of that information.
So once we pass the discovery call and actually schedule a consultation, what I'll do then is what I would ask my patients is very, very simple, is start putting together a list of your medications and supplements, exactly how you're taking them, not just how they're prescribed. And then tell me what you've been told. Show me your most recent labs, show your blood labs, your urine labs, etc. Show me your X-rays. Show me the reports from your most recent doctor's visits and all your specialists. Let me put all that together. And once I have an idea of what this person is taking, or I should say what they're taking, and then looking at what they're supposed to be taking and how they're supposed to be taking it, then I start doing my thorough review of, let me look at this patient as an individual. So there's a phrase that we learn in school is treat the patient, not the numbers.
Yes.
And so rather than just saying that this patient has this level of sodium or this electrolyte or this difference in electrolyte, sometimes that's normal baseline for that patient. Other times it's not. So we want to try and treat the patient. And so I'll first look at, again, all the prescription medications and supplements and whatever else this person might be taking. By the way, almost every one of my patients at almost every age doesn't tell their doctor everything that they're taking
Right.
intentionally.
Yeah.
And when I
Or
talk
I
with
think
them,
even just not knowing, I think a lot of people are taking over the counters or supplements and not realizing the effects that they could have.
right, just because a medication is sold over the counter or through Amazon or in a Eastern medicine market doesn't mean that it's safe.
Yeah.
Those medications tend to be less catastrophic compared to some prescription medications, but they are not without their dangers as well. You can easily get into kidney failure and liver failure with a lot of these over-the-counter medications. Equally bad, you can destroy your what's called your microbiome in your stomach and in your body, which will lead to disease. Again, that's different. That's fodder for a different podcast. So what I would do with my patients, I would ask them for a list of medications, what they're taking. And then once I meet with them after I review their medications, I start asking them these very specific questions about their lifestyle, their other supplements, what they're doing, and then start branching outwards about, well, now that we talked about medications, let's talk about nutrition. What are you eating? What aren't you eating? Many people are taking supplements because they're not getting the right nutrition from their food sources. Well, if we can tweak their food sources a little bit, then perhaps we can remove some of these supplements, which will be infinitely better than liver in a pill, if you will. And then from there, we move outward and outward to medication, supplements, and nutrition, followed by sleep hygiene. Almost everyone is on some form of a caffeine kick, and which is great. I mean, and I'm guilty of that sometimes as well. But the more basic question is why? Why is everyone so abundantly tired? So we need to go back and start working on, well, why aren't we sleeping very well? What are we doing to damage the sleep hygiene? Sleep is literally vital. So if we're doing something that is causing us harm, short-term or long-term, then we should address that. The lack of sleep will cause an increased risk of dementia, increased risk of heart disease, increased risk of diabetes. And if you don't sleep for enough time, it's actually mortality. It's actually going to kill you, literally.
Mm-hmm.
And so sleep is vital. And then from there, I work out to stress management, anxiety management as well. So I try to put together the entire package for a patient or for physician's patient, so I can give the physician a better patient and or help the patient be a better patient and try to get them off of medications.
Yeah.
I've helped reverse type 2 diabetes in a number of my patients. And so now they're happier, they're healthier, they're out there. No, they're not in acute kidney failure, and they're off of their insulin and diabetes medications, and they're loving life. And so these things are possible, with the right approach, with the right professional clinical approach.
Yeah, I think it's kind of what you had touched on is just the individuality of it that you are doing, because, the endocrinologists and stuff, just with the type 2 diabetes, you're getting a booklet of information that's general. And then it just sometimes just lifestyles and habits and that sort of a thing, things don't stick, or just like you said, on some of the lab values and stuff, what may be in kind of a normal range isn't normal for each individual type person. And kind of just being able to deep dive individually with people is kind of, I think, the key that's missing in healthcare. Is it's just gotten, I don't know, more slammed and more busy, and just the amount of time that, people can spend. And I really kind of appreciate kind of the approach that you have, because it's the same, sleep, especially with my patients. I don't think they realize how much it's contributing to their pain or their recovery after, sporting events and that sort of a thing, that if they're not getting the proper amount of sleep, then they're also affecting their performance and recovery levels as well. So exactly. I love the whole full rounded umbrella approach. Yeah. So kind of on a lighter note, I'm always kind of just with that trying to incorporate, I'm always educating my patients. And then with that education, I'm trying to turn that education into habits that patients can actually stick with. What would you say that one wellness habit that you have personally, that you prioritize no matter how busy life gets?
Really great. That's a really great question. I think that if there's only one thing that your listeners take away from this great podcast is, and again, there's a multitude of things to learn from this, and other podcasts and other discussions we can have. I think probably the most important thing is be an active patient. And what I mean by that is ask questions, ask the why. What brought me to this position that I'm in front of the doctor's office now, and I'm in this, I have this problem, acute or chronic issue. And what could I have done to have prevented this, or what can I do starting today to fix this? Again, you can go off on 100 different tangents of that, but I think probably the most important thing that people don't fully appreciate is nutrition. And the mind, body, and spirit component is very important. Managing your medications and supplements, and nutrition and sleep and mental health are all extremely related, and everything is important. But I think if there's the first step, not the only step, but the one first step that people can do towards better health, is whatever they're eating, whether they're going to buy at the grocery store or at whatever restaurant, whenever possible, turn it over and read the ingredient list.
Yep.
And people, if you actually sit down with the dictionary, with Google phone, with Siri, with ChatGPT, and have them explain what those ingredients are and most of the things that people eat, they probably would second guess whether or not they should eat that stuff. Most of those things, most of the things that we as people are eating in today's society are not very good for you. And what I mean by not very good for you is they cause a plethora of medical issues. And so the things that we're trying to do as doctors to help people are caused primarily by the things that people are doing to themselves, relatively inadvertently. So I think if there's one takeaway, if you will, is the mind, body, and spirit of, take care of your body, exercise very well. If you need something, find a great person to help you with, whether that's physical therapy, whether that's a gym membership, whether that's just going outside and walking. In the great state of Texas, you can walk effectively every day of the year, more or less, which is a great thing to do. But understanding what you're putting into your body, onto, around your body, whether that's creams and ointments, whether that's makeup, whether that's a supplement, a prescription medication over the counter, and most importantly, the food that you're ingesting. What are you putting in you? And most likely, when you realize what you're putting inside of you is probably hurting you, hopefully that's a step in the path of, well, let me talk to someone who knows about this better than I, to learn about ways to mitigate, the stuff that I'm getting, whether that's a dietary change, whether that's a supplement change. So I think that'll be my biggest takeaway for your listeners, is that for most clinical issues, not all, But for most clinical issues, an appropriate lifestyle of managing medications, supplements, nutrition, sleep, and mental health would fix or at least mitigate most clinical issues. And I think that's probably the biggest takeaway that I can give to your listeners.
Yeah, I always try to end each episode with one small move for my listeners. And kind of, I think the takeaway there is just try to educate yourself and maybe just ask, the next provider appointment that you have, what's one small tweak that I can make to better this health situation that I'm trying to manage, basically. So I love that. This conversation is amazing. I have so many more questions just to be able to go down the whole rabbit hole of active adults working to try to optimize performance and sleep and health and nutrition, and kind of then the whole world of the supplements and where you're getting your supplements and what are you taking. And, there's tons of conversations that can spark off of this. So I thank you so much just kind of for introducing my listeners and me more into just the aspect of being able to understand kind of what the medications are doing, and that there's somebody out there that you can talk to understand, like, do you need to be on all of these medications? Is there a better way to optimize taking these medications with, food and supplements and, all of the rest of it as well. So thank you so much for your time.
Thank you very much for the opportunity to talk to you and your listeners. Thank you.
Thanks. Bye.